Well, there are a couple of stories making medical headlines today.
How fit is the city you live in? The top 10 fittest cities in the U.S., they have been revealed.
We'll see if any in Wisconsin made the list. But first, there has been an increase in whooping cough cases in Dane County. 43 cases have been reported in the last 8 weeks. UW Health's Dr. Jeff Pothof is here for his weekly visit. Hi, Dr. Pothof.
Hey, how are you guys?
I thought whooping cough was a winter thing.
Yeah.
What is it exactly?
Not so much. So whooping cough is a bacterial illness. Bordetella pertussis is the bacteria that causes it, and we typically don't see it much at all. But we are seeing a bit of a spike right now here in Wisconsin, 43 cases. You know, what typically happens is individuals get vaccinated for this as children. You get kind of like your last booster between age 11 and 12. And then there's a recommendation that about every 10 years you get a booster. And you typically get this with your tetanus shot. People don't realize it, but tetanus has more than just tetanus in it. And what we typically see in the U.S. is at those adolescent years, so like you're past your 11-year-old, 12-year-old shot, but you're not quite to that, 22-year-old shot, your immunity starts to wane. You get whooping cough. You don't get really sick, but you do increase the risk of folks who are either very, very young, so like infants, or very old. If they catch this, they can sometimes do somewhat poorly if they come down with whooping cough.
And it kind of presents as a cold at first.
Yeah.
And so how do you treat it then?
Yeah, so at first it's really hard to know if you have whooping cough because it presents like everything else we always talk about: COVID, flu, common colds, things like that. It's not until after that resolves and you get this cough, which is very distinctive. Basically, when you try to exhale, you'll just start coughing to the point where you're like out of wind, and you take this big breath because you couldn't, and then that creates that whoop. Which is where it gets named after. Once we kind of figure that out and you get tested and you have it, you can get treated with antibiotics that can help. And then typically, much like with the early days of COVID, you kind of contact trace and be like, so who were you in touch with? Do we need to put those people on antibiotics too to prevent more cases of whooping cough from happening?
Does it spread pretty easily?
It's pretty easy to catch, yeah.
Okay, so probably high school athletes and summer camps and places like that?
Absolutely, absolutely, yep.
Okay. All right, let's talk about the top 10 healthiest cities in the country. This was in the American College of Sports Medicine, their latest issue, and they looked at things like exercise, obviously, sleep. You made a good point about mental health services.
Yep.
It was a big part of the rankings. And let's see what the #1 city in the country is: Arlington, Virginia. Here's the top 5. I thought we were going to do them one at a time. Arlington and Washington are pretty close.
Yeah.
They're very close to each other. Seattle, San Francisco. Hey, look at this. Madison is #5. That shouldn't surprise any of us, right?
No, I think Madison wins a lot of accolades for being like not a bad place to live. So looking at this ranking, which did look at how well do we sleep. They must not have surveyed me for this one.
Or me.
but how well do we eat, mental health resources, and then exercise. They take these all together, and we perform pretty well here in Madison.
Yeah, it's a fit city. I saw someone riding his bike even in that downpour today. So I think people, no matter what, like to get outside and get the blood pumping.
I just think Madison lends itself well to that. We've got like a great bike network. We've got the lakes. There's lots of areas to recreate. It's not a bad place if you like to be outdoors. There's a lot of places to go.
Do we have the bottom 5 too, if you're curious, after Madison? 6, well, I'll just tell you. 6 was Minneapolis, 7 was Denver, 8 was Atlanta, 9 was Irvine, California, and 10 was St. Paul. So a lot in the Midwest.
Can that make a difference in your health if you live somewhere and you see, people out exercising or people doing stuff? Can that influence you to make those decisions?
Well, I think it starts to inform culture, right? So there's all these local cultures that we have, and if you're living in an area where it's just like everyone else seems to be out doing things outdoors and that's just what people do, you're likely to become one of those people that just do that too, and that can reinforce good habits, whether it's exercise or diet or sleep. We tend to kind of emulate the people that we hang around with.
And back to the whooping cough quickly. If you're feeling any of those symptoms, what's your guidance to do?
Yeah, I think if you're having that cough, certainly I'll call someone. I think otherwise what you're trying to do is the things that we usually do. If you're feeling sick, don't go out in public in case you have whooping cough. Don't give to other people. Good hand hygiene is good with this. But if you do develop the cough, or if Public Health Madison-Dane County contacts you and says, hey, we have some news for you. It seems like maybe you were in contact with someone with whooping cough. Take that seriously and probably get on the antibiotics.
Okay.
Thank you very much.
Great to see you, Dr. Pothof. Thanks.